So the best way to determine low back pain is through a complete assessment. This can be through observations, such as a painful or antalgic posture, the loss of lumbar lordosis, or the inability to maintain a neutral pelvic position, such as they may tilt the pelvis unnecessarily, and this can actually indicate a lack of movement control, muscle strength, and imbalance. In active range of motion, if the problem is mechanical, at least one of the movements will be painful. And in passive range of motion, the posterior to anterior glides show full and pain-free motion with a normal end feel of tissue stretch. For the rule-outs, you would choose the hip and the thoracic spine by applying active range of motion with overpressure in 2 ranges in 2 planes. For the peripheral joint scans, you would only do these if there is no mechanism of injury. The functional testing, such as the Oswestry Disability Index, can also be helpful in determining low back pain.
Okay, so now I will present passive range of motion of the lumbar spine, looking for any low back pain through passive and posterior to anterior glides. So starting at the iliac crest, I will move medially to the spinous process of lumbar vertebrae number 4, move just superiorly and just inferiorly to the spinous processes of the lumbar spine. Individually, I will test the lumbar spinous processes by pushing anteriorly to mimic extension of the lumbar spine and letting it spring back to mimic flexion of the lumbar spine. I'm looking for a good spring back. And if there is any pain or recreation of symptoms, which I will ask my client, is there any pain or recreation of symptoms? No. If there was, that would demonstrate that it is a non-contractile tissue since we are doing passive range of motion. Okay, so now I will demonstrate active and resisted range of motion in the flexion state of the lumbar spine, looking for any pain or recreation of symptoms to test for low back pain with a muscular involvement. Could I get you to bring your chest to your knees as far as you can? Any pain with that?
No.
Okay. Now I'm just going to place my hand across your shoulders and I'm going to get you to resist into me. Build for 5, hold for 5. Go ahead. 1, 2, 3, 4, 5, 5, 4, 3, 2, 1. Any pain or recreation of your symptoms?
No.
Now we'll test rotation of the lumbar spine. Could I get you to bring this shoulder to that window for me and twist? Any recreation or pain?
No.
Perfect. And I'll just get you to resist into my hand here, stabilizing at the other shoulder. Go ahead. 3, 4, 5, 5, 4, 3, 2. Any pain or recreation of symptoms?
No.
Perfect. Now we'll get you to extend your arm down and bring this shoulder as far as you can to the ground. Any pain or recreation of symptoms?
No.
Perfect. Push into my hand here. I will stabilize at the other iliac crest. 5, 5, 4, 3, 2, 1. Any pain or recreation of symptoms?
No. Special tests, such as the leg length discrepancy, modified Trendelenburg, dynamic abdominal endurance, centralization or peripheralization, straight leg raise or Lesiegs, passive lumbar extension, quadrant or Kemp's test, Eli's, Thomas, Farfans, Hoover, and Babinski are also very helpful in determining low back pain. Joint play can also be used. Now I'll be performing the passive lumbar extension test. In prone, I'll be standing behind the patient, grasp their ankles, in an athletic position. I'm going to pull back and up. Thank you. Do you feel any pain in the low back?
No.
It can often be described as the back being pulled off and can be immensely painful for clients with experiencing low back pain. I'm performing Eli's test. To do this, I'm going to ask that you bring this knee to your chest while holding my hand underneath her opposing knee. The space between her knee and my hand increased, showing that she has shortened rectus femoris. Farfans torsion test tests for the stability of the facet joints, joint capsule, supraspinous and interspinous ligaments, the neural arch, and the disc. To perform it, I would place one hand here, grab the ASIS, and torque the hip and the low back. Does this recreate any of your pain or your symptoms?
No.
Pain and a recreation of symptoms would be a positive test for the Farfans torsion. Thank you. Potential contributors to low back pain are, according to the article, effectiveness of core muscle stabilization exercises with and without lumbar stretching, and non-specific low back pain. Low back pain can be caused by a decreased abdominal strength and insufficient control of the deep abdominal muscles. According to the frequent benign, non-traumatic, non-inflammatory causes of low back pain in adolescents, MRI findings, the causes of structural disorders, degenerative changes, Sherman's disease, fractures, inflammation, and tumors can all cause low back pain. Herniations, trauma, SI joint dysfunction can all also contribute to low back pain. Impairments involved with low back pain include a high resting muscle tension, increased adhesions, trigger points, and muscle weakness within the low back, and compensatory issues and upper cross syndrome can also be involved. The client may experience a decreased painful ranges of motion in one or more movement. They may have difficulty sitting for long periods of time.
So the modality chosen to treat low back pain is interferential current therapy. This therapy is often used to relieve pain and accelerate self-healing processes in patients. It uses high-frequency signals to penetrate through the skin into deeper lying muscle tissue. Electrode pads are placed on the skin to surround the injured or painful areas and transmits electrical impulses in small quantities through the skin. It also stimulates underlying tissue and nerves, which begin the healing properties. It's not a painful treatment, but rather a minor prickle on the skin, similar to a light sunburn. The frequencies emitted from the IFC are proven to stimulate endorphins, which are the body's natural painkillers, to reduce joint and muscle pain. It is extremely useful to reduce pain, inflammation, curing edema, and minoring spasms. This modality is commonly used to reduce or eliminate pain safely, decrease swelling and inflammation noticeably, improve range of motion and limit restricted movements and coordination, stimulate natural hormones to help the body heal faster, treat chronic pain, circulatory and muscular disorders, joint stiffness, cumulative trauma disorders, and aid in pre- and post-orthopedic surgery, prep, or recovery. It also has been proven that IFC therapy is beneficial in reducing pain, lowering disability due to back pain, and lowers patients' medical consumption of pain relievers. It is also proven to be most beneficial when used with manual therapy.
Okay, so we're just going to go through the diagram just to give you a little bit more of a picture so you can see it better. This is a diagram of what the machine would look like and the specifics of it. So this is my client today. She's coming with low back pain. Can I ask you to point to where your pain is? Okay, so she has pain right here. So you have 4 pads that shoot electrodes through. So I would place my pads here, 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 and here. And that would allow for all of the electrodes to center in onto where the low back pain is coming from.
Okay, so as for treatment planning specific to this modality and scenario, I would like to go through the treatment goals, the contraindications, and the indications, as well as how to incorporate this into a treatment plan to produce lasting and beneficial effects for your client. As a massage therapist, it's important to find new and effective ways to make your client feel satisfied and good after treatment. According to the Interferential Current Therapy article by the Department of Physiotherapy of Queen's College in Glasgow, interferential current therapy is one of the newer and more technical forms of therapy that can be introduced into treatment to maximize the outcomes of your goals. Interferential currents have multiple benefits for low back pain in specific. Reducing inflammation and swelling in our surrounding structures of the low back is a major goal. Next, reducing reports or complaints of pain is one of the most important outcomes. Because of this therapy can decrease pain for clients, they will want to come back and feel better afterwards. This also helps with the healing process of edema, as well as decreasing spasms to a minimum level for the individual. It also increases range of motion measurements and results for the T-spine, L-spine, and hip movements, alongside helping to achieve all-around greater mobility. Lastly, this is a good way to create an overall faster way to heal the body's problems and chief complaints. It's very good for targeting specific areas of pain on someone's body. Like all impairments and therapy options, there are contraindications to be mindful of when treating. Some indications of the specific therapy potentially being a suitable option: if your client suffers from swelling, inflammation, pain, or edema, or all of them. In your assessment and health history, you should make note of any present pacemakers, local malignancies, very acute inflammation, fever, tumors, thrombosis, or if you are treating a client who is pregnant, you need to be mindful and careful about not performing the therapy near the low back or abdomen. And of course, if the client has any marked notes or knowledge of a reason to not receive this therapy, then of course avoid it completely. As for treatment planning, it is possible to include interferential current therapy into any treatment with clients who have no contraindications. For instance, you would continue with a regular impairment massage and determine low back pain as the chief complaint for the treatment. Next, you would perform active range of motion, passive range of motion, and active resisted range of motion to confirm whether the pain is mechanical or nervous, which will help you piece together the information to create a hypothesis. Next, you would perform rule-outs of the hip and T-spine, as well as your joint scan. And then special tests would come next to determine if there are any underlying issues or compromising structures. Then you could progress with treatment and use interferential current therapy if one of the chief complaints is indicated that this treatment could be beneficial for, in hopes of furthering the manual therapy's results. So in conclusion, we believe that interferential current therapy is a great way to decrease many symptoms and limitations involved with low back pain. It works best when partnered alongside manual therapy and is most beneficial when a full assessment is completed prior to treatment. Thank you.